Good evening. On behalf of LAist, welcome to this AMA on COVID and kids. I'm Jackie Fortiér, Senior Health Reporter at KPCC and LAist. All of the programming on KPCC and LAist is made possible by the generous support of our members. We want to say thank you to all of you. If you're not already a member and you're in a position to give, you can visit us online and at support.laist.com/events. If you want to stay up to date on our upcoming events, virtual and eventually in person, please sign up for our events newsletter. You should also see the link for that posted in the chat. Now, throughout tonight's event, I invite you to engage with us. And of course, your fellow attendees in the chat section. You can also access that by joining the chat to the right of this video on your screen. And if you need any technical assistance, you can post that there as well. Also, if you have questions for the panel, you can share those during the Q&A using the Q&A function. You should see another button for Q&A just below the chat. So tonight, we're going to be talking with UC Irvine Professor Andrew Neumer and Dr. Olga Guijon, pediatrician at Children's Hospital Orange County. You can submit your questions with that Q&A function located at the bottom of your screen, like I said. We also have live captioning available. Just click the CC button at the bottom of the video. So let's meet our experts. Andrew Neumer is an associate professor of population health and disease prevention at the University of California, Irvine. He's an epidemiologist and has almost exclusively been studying COVID-19 for the past 26 months. Dr. Neumer, welcome.
Thank you for having me. I'm glad to be here.
We're also joined by Dr. Olga Guijon, Division Chief of Primary Care at Children's Hospital Orange County. Dr. Guijon is a pediatrician who treats children and teenagers and has done so throughout the pandemic. Thank you so much for being here.
Good evening. Thank you for having me.
I just kind of want to get the ball rolling and then we'll jump into viewer questions. I mean, a lot of parents have been eagerly awaiting the news of the COVID-19 vaccine for children under the age of 5. For either one of you, Olga, maybe we should start with you. Are you optimistic based on what you've seen so far about the Pfizer studies?
I am really excited. We in the pediatric world have been waiting for this day when we can start vaccinating our youngest children. So far, the vaccine data for Pfizer looks very promising. It is a 3-dose vaccine. And so far the safety and efficacy data is promising. It is very comparable to what we saw in the older teens and in the young adults as far as the immunogenic response. So.
How do Pfizer's results compare to Moderna's?
Well, so interesting. So with Pfizer, when they looked at the efficacy, it showed about 80% efficacy against symptomatic disease, but it is really early data because it was released in March. So it's early data, a little bit early. But when they looked at the actual immunogenic response, again, that was very similar to what they saw in the older age group. And as far as Moderna, they showed it was, I believe, 37% for the younger 2 to 6 months to 2 years. And then for the 2 to 5 year old, it was about 37%. And 41%, I'm sorry, for the younger age group, and then for 37% for the older. But again, this was against the Omicron, but when they looked at the actual immunogenic response, again, it was very similar to what their vaccine for the older age groups showed as well. So what they've shown and what they predict is that it will be effective against severe disease and hospitalization, which is really what we're aiming for.
Mm-hmm. And so the Pfizer vaccine right now is three doses then for the younger kids, and the Moderna is just 2, right?
Correct. So initially, Pfizer started out with a 2-dose vaccine. And while they found that it was safe, what they found is that it didn't produce the immune response that they were looking for. So then they developed the 3-dose vaccine. And it is 3 micrograms, which is just 1/10 of the adult dose. And then for the Moderna, that is a 2-dose vaccine at 25 micrograms, so a quarter of what the adult dose is.
Right. And just to be clear, like these are the same vaccines that have been out there for, 18 months now for everyone else. It's just a smaller dosage of those vaccines.
It's the exact same vaccine formulation, just a different dose for the younger kids.
So the FDA announced a meeting of its external advisory committee on June 15th. Agency officials said that they will, discuss both Moderna and Pfizer's applications for the younger children on that day. And then, the White House has kind of indicated that vaccination could start, as soon as June 21st for those kids under 5. You do a lot of vaccinating kids, Olga, so I'm curious how you're kind of prepping for, I don't know, a lot of people coming in and getting their kids vaccinated.
So we are getting ready. We've already ordered our vaccine, so we're getting ready to have it delivered once it is approved. Mm-hmm. And we've already started educating our families and telling them that hopefully by the end of the month, give us a call and we can get your younger children vaccinated. I think with the younger group, there is a little bit more reservation from some of the parents. Some of them, are really excited. I've had some parents who have been calling our office, do you have the vaccine? Some of our pediatricians who have young kids are just, are asking, when are we going to get the vaccine delivered? They're super excited. And then we've got some other families that are just not quite ready and are, I want to wait and see. I want to see what happens with the other kids. So we've got a whole spectrum, but we at CHOC have, since the vaccine, have vaccinated we've given over 25,000 doses.
That's fantastic. Well, let's get to some viewer questions. If you're a viewer, you can post yours now through the Q&A function at the bottom of your screen. We had one come in. The question is, understanding that we still have a lot to learn, what is known about the prevalence of long COVID in kids and teenagers? Who would like to talk about that?
Well, I'll take a stab at it, and I'm sure Dr. Guillon has her thoughts. We don't know as much about long COVID in children and adolescents as we do in adults, and COVID is somewhat mysteriously and thankfully less severe, generally speaking, in children and adults. Which is unlike flu, which affects kids and the elderly. COVID disproportionately affects the elderly, but I mean, long COVID is documented in kids. Long COVID is documented in adolescents. There's still a lot of questions about this, hepatitis of unknown origin in kids. I don't know that it's related to COVID, but that's one of the hypotheses. That could be a form of long COVID. And so, long COVID does exist in children and adolescents. We know this. I think we know a lot less about it than we do about long COVID in adults, but it's not another reason, why we should be excited about vaccinating kids and why we should be excited about the under 5s being made available as well.
Well, and then do we even have a working definition of long COVID in children? I mean, it's such a broad spectrum of symptoms that have kind of just been grouped by that. But to my knowledge, I mean, there isn't like a working clinical definition of long COVID, right?
That is why we're having such a difficult time really determining what the incidence of long COVID is, or post-COVID syndrome is the other term that's being used. And that is exactly why, because there is no definite criteria as far as the definition of the symptoms or the length of time that the symptoms have to persist in order to have a true diagnosis. There's several studies that have been done, but they're also varied, that to try and really sort out all of that information is really challenging. But what we do know, and what's interesting, is that we do know that kids have it, they do get it. And what's interesting is that some kids who have very mild illness can have long COVID syndrome, and some kids even who had asymptomatic disease, meaning that when they were infected, they didn't have any symptoms, can also have long COVID syndrome. So that is what's interesting. And I think, just to really stress the point that Andrew made, is that we do know that being vaccinated and getting your 2 doses of a COVID vaccine can have a protection for long COVID syndrome. So that is an important point that we do know.
I mean, let's delve into that a little bit more. So if I have a child and they may have COVID asymptomatically, and then a few weeks later, they're complaining of I don't know, listlessness. That's what I'm trying to say. Not being able to concentrate, maybe at school. These are kind of the symptoms that I've heard that have cropped up, especially in older children, especially. Sometimes it's gastrointestinal, but it seems like it's the long COVID symptoms are further away from the respiratory that we kind of tend to associate with, especially COVID initially. Is that correct?
That is correct. And in some studies, they're showing that one of the biggest symptoms is headaches. And as you mentioned, inattention is also, difficulty concentrating. And then also sleep disturbances is another, and then even mental health is now being attributed to long COVID. So there's a whole host of symptoms, but really, it's really hard to define because there is no true definition for what long haul COVID is. Right now, the treatment is treating the symptoms. I think there's a lot for us to learn and a lot that we still don't know.
Yeah, and I'd like to add, just perhaps to clarify my earlier remarks, everyone can become infected. Every human being can become infected with SARS-CoV-2. Whether we become symptomatic, whether we have these flu-like illnesses or other illnesses as a result of that infection, or whether we are simply asymptomatic, is depends a lot with age. I mean, children are much less likely to be symptomatic, but this is well documented from antibody studies and from PCR studies, finding live virus in children's airways. Everyone can become infected with COVID, with SARS-CoV-2, the virus that causes COVID. And so, this, contrary to what has been sometimes said that, kids don't get COVID, I mean, everyone can become infected with SARS-CoV-2. And even in adults, there's symptoms that show up, brain fog and whatnot, after asymptomatic infection. And this can happen in children as well. So children are much more likely to be asymptomatic, but absolutely, all human beings can become infected with the virus that causes COVID. And so, it's a distinction with the difference, this asymptomatic versus asymptomatic doesn't mean it didn't happen. There's still infection in kids. And that's something I think I should have stressed a few minutes ago. But
yeah, thank you for that clarification. We got another question that's related. This person says, I'm a pediatrician and am a proponent of vaccination, but it doesn't seem that studies show that vaccination decreases the propensity to have long COVID, whether neurologic, pulmonary, etc. I mean, vaccination would keep you from getting infected, which would potentially prevent you from getting long COVID, though, or help keep you from getting infected.
Indeed. Go ahead. Andrew. Well, I was just going to say, I mean, in adults, it's clear that there's a prevalence of breakthrough infections that that is not what any of us would have hoped for 18 months ago. And I mean, I think it's important to be candid about that. I mean, we all know people nowadays who've had their test kits light up even though they're vaxxed and boosted, and that's a fact. It's unfortunate, but I mean, part of the reason why Omicron is so mild is that it's hitting a highly vaccinated population. And so, it's probably quite poorly studied in terms of, long COVID versus vaccination. But, we know that going unvaccinated, in adults is much more likely to lead to severe symptoms and mortality. Obviously mortality from COVID is much rarer in kids, but this is a virus that is we're still learning about every day, and it's kind of taken the world by storm, as everyone knows by now. And I mean, any kind of immune protection that the vaccine offers, I think, is well worth the effort.
Olga, did you want to add anything?
I absolutely agree with Andrew that any protection it can provide, but the reality is we really don't know. We don't have a good definition. We really don't know. And then with the asymptomatic kids, some kids may be coming in and we don't even know it's long haul COVID because it could be attributed to something else. So I think there's still a lot for us to learn, but we really don't know.
I spoke to a teenager, and I did a story on it in April, but he ended up being diagnosed with long COVID, and he went to, a few times to various pediatricians and specialists before he was eventually sent over to Children's Hospital, LA, where, like you said, they treat the symptoms because there aren't any therapeutics for long COVID right now. But that none of the physicians knew what he had. It wasn't really at top of mind, and it was only because his dad had long COVID that he thought, oh, maybe he does too. He had a symptomatic case of COVID as well, but it took a while before that was diagnosed. Someone asked, if kids tend to not show symptoms, does that work against the message of the need to get kids vaccinated?
Well, from my perspective, no, although it's a very good question in terms of the effort versus benefit ratio. If most cases are asymptomatic, what's the big deal? It's been long thought that with influenza and other seasonal diseases that the school year plays a strong role in the seasonality of those diseases. And I mean, this is something that's been, a topic of research in my field for a long time. And it's still a topic of research, but the point is that kids can drive the epidemiology of infectious diseases because they congregate in school in classrooms of 30 other kids, and then they go home to families, households, sometimes multi-generational households. And so kids can be a driver of a lot of epidemiology. So by reducing viral load in kids, it reduces, even if there's some breakthrough cases among kids, there's less viral shedding, and it dampens down the seasonality of the phenomenon. Everyone always says, well, it's flu because it's the winter and it's cold, but even places like Hawaii have flu seasonality that is winter dominant, and certainly Southern California also enjoys a very moderate climate, but we still see flu in the winter. And so the school year is really, and the role of kids is really a leading hypothesis for why we have these winter dominant respiratory viruses. And so I think we can save the lives of grandparents and parents even indirectly by vaccinating kids. Even if the kids are very unlikely to die, and that's on top of what we were just discussing about long COVID and the rare but not extremely rare cases of kids with symptomatic disease hospitalized. Olga can probably say more about that than I can, but it's rare for kids to get serious cases, but not extremely rare, and so. That's also, I think, a distinction that's worth observing.
And just to add, as Andrew said, from the epidemiologic standpoint, that is important. But, although we know that kids don't get a severe disease and some of them can be asymptomatic, it's not insignificant. We've had over 40,000 kids hospitalized because of COVID. And unfortunately, we've had over 1,200 deaths related to COVID. So to those families, that is devastating to have that. So that is, a good reason to vaccinate. And then, we also have the risk of multi-inflammatory syndrome as well that we've seen in children, and the myocarditis or the heart inflammation. So even though kids can be asymptomatic, we still can have significant effects on these children.
Yeah, I was going to bring that up. Can you please explain the difference between long COVID and MIS-C?
So MIS-C is a post-inflammatory reaction, and it occurs in children and usually occurs in 2 to 6 weeks post-infection. And it can be very severe. It can present initially, kids usually present with persistent fever. They can present with vomiting, diarrhea, red eyes, rashes, and they can progress into having respiratory failure, heart failure, kidney failure, and death as well. So I think there was 68 deaths attributed across the country, according to multi-inflammatory syndrome. And so this is an acute response to post-inflammatory response. It's not an active infection, rather than it's a post-infection reaction. And something that we always warn kids, families, if they are diagnosed with COVID, that they do need to watch out for this 2 to 6 weeks after their infection.
Versus long COVID, where they have a continuing, again, there's kind of this myriad of symptoms, but it's this kind of pervasive problems, but it's not something where it's that acute where they, might need hospitalization.
Correct. So Miss C is a more acute during that time period, and it can be very, very serious. Whereas long haul COVID is persistent symptoms over a long time that can be sometimes serious, but some symptoms can be very mild, but because of their length of time, long haul COVID, they can be very debilitating over the long haul.
Thank you. I appreciate that. I think it's a distinction that is it's important to make. Another question, what's your advice about vaccinating kids who already had COVID?
My recommendation is to get vaccinated, because what we do know is we have we've had some variants. And so we do know that our immunity, even our natural immunity, does decrease. So we do recommend, and in fact, I just had some kids that were positive yesterday, and the mom said, "When can I come back to get my vaccine?" They were sick and had a fever that day, so we couldn't vaccinate them. But as soon as they get better and they pass their isolation period, they're going to come back and get vaccinated. Absolutely.
Let me take the audience back to March 2020 and when COVID first erupted on the scene, and we never heard so much about the 1918 flu as we did in that time period. And the reason we heard so much about the 1918 flu is that was kind of our mental model for what a pandemic of respiratory disease is going to look like. Well, guess people who listen to KPCC and people who are in this audience, they know that they haven't heard as much about the 1918 flu in recent months. Why have people stopped talking about it? Because the biggest difference between the 1918 flu and COVID, for our purposes at this moment of comparison, is that you can get COVID more than once, antibodies fade. And the 1918 flu, we know from sera collected by people who lived through it, still neutralized H1N1 influenza virus in vitro, 50 years later. So that's a huge difference. COVID antibodies wane. That's why we're in this mess, quite frankly. So anything you can do to boost your immune system, do it. So I think the best outcomes in adults who've had COVID have been those who subsequently got vaccinated. There's a delay. You can't get a vaccine when it's contraindicated if you're currently testing positive, so you have to wait. But I would not say having had COVID is a reason not to get the vaccine.
I've talked to a lot of people who've had COVID over the last 2 years, and including people who had it and then got vaccinated and then got it again. And they all told me, anyone in that camp, that they had fewer symptoms the second time. They did not get as sick. And this was kind of before the therapeutics came out as well. So none of them were taking like Paxlovid, but they said it was like night and day, that they just did not get as sick after being vaccinated. To throw that out there anecdotally. Another question, will kids need boosters as well?
So
probably.
Probably. And, given the fact that we've had so many variants, and they probably will be more variants to come. Currently, kids 5 to 11 now require a booster 5 months after their last dose. And that was just in April that was approved. So probably for the younger kids, we are probably going to be looking at boosters as well, but we'll look at what the data and what they present at the meeting on June 15th.
Yeah, I would just say, we don't know yet for sure, but all signs would point to yes. Kids 5 and up are boosted And, we don't have the data yet, whether, because we haven't vaccinated the under fives, whether they're going to need boosters, but it would seem so, based on all of our other experience. And the flu vaccine is approved for 6 months and up, and it's something that we do annually. So it's not precisely a booster because the formulation changes every year. But the point is, a child could get vaccinated for flu at age 1, 2, 3, 4, and 5. So there's precedent for multiple vaccinations for children for the same disease over the course of their childhood.
I want to remind our viewers, if you have any questions, you can post them in the Q&A function at the bottom of your screen. Olga, I feel like I looked this up and now I forgot. How young, and again, these vaccines for under fives haven't been authorized yet with an emergency use authorization by the FDA and the other federal vaccine gods yet. They're going to meet next week. But how, what's the age group for the Pfizer and the Moderna vaccines? How young can children be?
So for the ones that are going up for FDA approval and presentation next week, those are 6 months to 5 years of age. So they're for the youngest group, and the youngest group will be 6 months of age, similar to like what Andrew said for the flu vaccine, down to 6 months.
Okay. Is there anything, do you ever expect to see a vaccine for younger age groups than that? Because that's still 6 months of trying to keep babies safe.
Probably not. I haven't seen anything in the works, and that may, it would be difficult to conduct studies in those tiny babies. That's usually the case, but I have not seen any studies or any vaccines down the pipeline for that younger group.
Okay. Yeah, Andrew, did you want to add?
I would tend to doubt that we'll see vaccination of infants under 6 months. I mean, we generally don't vaccinate infants under 6 months for many things, partly because they have transplacentally acquired antibodies from their mother, and we don't for flu, for example. That would be a surprising turn of events.
Do we know how long those antibodies last right now in women who were pregnant and got vaccinated against COVID?
I haven't seen any studies specifically on that. I mean the sort of the textbook example is measles, where everyone who's had measles has really high and lifelong antibody levels against measles, and they pass it on to their children. And you can't really vaccinate a 3-month-old against measles because there's so many maternal antibodies circulating that it messes up the vaccine. COVID, as we said, the antibody response wanes, and so it probably won't be an extreme example like that. But I mean, we don't vaccinate against flu in infants under 6 months, and I just don't see authorizing smaller infants for COVID vaccination as being a priority of really any of the parties involved.
Okay, but in that situation, that's where like the cocooning, right, comes into play. We do that with like pertussis, whooping cough, or flu, for example, where you vaccinate the adults or anyone old enough to be vaccinated who's around baby or immunocompromised kids as well. Let me jump back to our questions. Have you found that the younger the child, the higher the reticence among parents to have them vaccinated? Olga, this sounds like a good question for you.
We have seen that for the younger age group, some of the parents are more concerned to vaccinate, and a lot of them want to have more data or want to have more experience. Usually my parents that are hesitant will tell me, I want to see 6 months. I want to see, what everybody else, what their experience is like. And
I'm curious. Oh, go ahead.
And for the teenagers, we had, initially we had some hesitancy, and then we had a little bit of a surge there on eagerness to get vaccinated. So hopefully it'll be the same for the younger ones.
Can you talk a little bit about some of the concerns that you hear from parents for under fives, and maybe what you tell them? Maybe we can hit on some of the questions people have or they're thinking about.
Most of the concerns are just because of them being young. Is it going to affect their growth in any way? Some of the concerns that we get is, will it affect, especially for the girls, will it affect their fertility? Some of them are concerned because it is an mRNA vaccine. It is a newer type of vaccine. We've never had an mRNA vaccine before. So they want to know, is it going to affect them in any way, especially in a young developing brain? So these are some of the questions that I've had from some of the parents. Will it change their DNA? And we know that the answer is no, it's not going to do that. And we know that it doesn't affect fertility. So far, all the studies have shown that it has no effect on that. In fact, we're recommending vaccination in pregnant women as well. So we know that, but answering those questions that parents have is an important part of our job every day to be able to answer this.
This is an interesting question. Here in LA, the largest school district, LAUSD, has not mandated vaccines. Their question is, do you wish all schools would? There is a potential school vaccination, like adding the COVID-19 vaccines to the required vaccines that kids have to have for the 2023 school year. That's kind of a question in the state legislature right now. The California Department of Public Health initially said that they were going to do that starting with this next fall, and then they pushed it back. But I mean, do you wish that they would institute a vaccine mandate?
That's a difficult question to answer because there's so many factors. You have to take into consideration, the parents' concerns. It is a newer vaccine, and we have had so many kids already vaccinated. If we start looking, we have had a quite significant number of vaccinations, especially in the teenagers. We still have a ways to go, and especially here in California. If you look at vaccination rates, we have some of the higher vaccination rates, which is something to consider as well. But I'm going to hold off on that answer. I don't think there's a lot to consider once you institute a vaccine mandate.
I'm going to give a similar answer, Jackie. I'm against mandates for vaccines that are still on emergency use authorization. So I think the time to talk about mandates is when they're fully FDA licensed or approved, as the term is. And I'm just a big believer in carrots over sticks. So educating parents and children, talking to them, showing them data, talking to them about risks of COVID, talking to them about how some of the documented side effects of the vaccine are actually the same as documented side effects of COVID, but milder. Mm-hmm. Carrots over sticks. A mandate is a stick. I prefer carrots, and I'm against mandates for EUA vaccines. We can talk about it when it's fully FDA licensed in the relevant age groups. So just because a vaccine is fully FDA approved, which some of the COVID vaccines are now for 18 plus, doesn't mean they're approved, that they're still on EUA for some other demographic groups. So that's where I stand. I mean, let me be clear that I'm absolutely, in favor of people getting their children vaccinated, but the question was narrowly mandates. And I think that's, it winds up rubbing a lot of people the wrong way, and it creates a lot of friction instead of creating alliances for improving everyone's health and well-being.
Well, if you guys, viewers, have questions, be sure to post them now in the Q&A function at the bottom of your screen. I'm looking to see a few more questions pop up. So if you have anything that you want to know about kids and COVID, now is your time to ask. I am curious, when we're talking about children and myocarditis. I mean, I know that that's come up a lot in relation to vaccination, but COVID also causes myocarditis, or can. If you guys could explore that topic a little bit more.
Well, Olga probably knows more than me, but that's what I meant when I said, like, some of the documented side effects of the COVID vaccines are also documented side effects of SARS-CoV-2 infection, except that the infection actually occurs at a higher rate. So if you're comparing, if you COVID vaccinees to people who, haven't been vaccinated and haven't gotten COVID, then you'll see some myocarditis among the COVID vaccinees. But if you compare them to if you wait long enough, everyone's going to eventually be exposed to COVID. And so that unvaccinated group is over time going to have higher myocarditis rates, because myocarditis is also a side effect of COVID infection. And so, it's a subtle distinction, to be fair, but it's one I think that the audience can understand. And so, the vaccine is a net benefit, and it's important not to just sort of cherry pick, so-and-so in, Rancho Cucamonga who had a reaction to the vaccine or whatever. You have to sort of, look at all of us.
And Olga, is myocarditis, does it, or did we lose her? It looks like we might have lost her.
It looks like we might have.
Yeah,
I
okay.
hope she'll rejoin us, because she's a pediatrician.
I hope so too. But the myocarditis that we've seen, especially from vaccinations, I mean, that tends to resolve, right? It's not
Correct.
It's not for the rest of your life.
It's not a permanent disability. And, for adults, there's a new vaccine on the horizon, Novavax, which, which has lower rates of myocarditis in its clinical trial than the mRNA vaccines had. So, as we move forward, there's going to be options, I hope, on the table for even better vaccines. And that vaccine is not currently in the cards for children, the Novavax, but I expect that eventually it will be. For the audience who hasn't been following that, the Novavax vaccine is a traditional sort of finger quotes vaccine. It's not against COVID. It's not an mRNA vaccine. And it's not an adenovirus vectored vaccine the way the Johnson & Johnson vaccine is. And again, for the audience who hasn't been following this as closely, the Johnson & Johnson vaccine is sort of in the sidelines now. It's sort of been benched. It's still available in some specific cases, but it's not in wide use any longer. And Olga's back with us, I think.
I am so sorry. I lost my internet.
That's okay, no problem. Thanks for calling back in. We appreciate it. We were just talking about the Novavax vaccine, which is hard to say.
But before that, there was a question for you about myocarditis.
Oh yeah,
I guess.
Thank you.
Yeah.
So with myocarditis, that's a common question that we get from parents. And having a young adult male son, this was something that was truly personal for me as well. So this is probably one of the biggest questions I get from parents. And I'm not sure, Andrew, what you already shared, but as far as for myocarditis, as you had mentioned, you can get it from both the infection and from the vaccine. But what is important to know, and just a number to give, there was just a recent study done by the CDC, and they showed that in the 12 to 17-year-old group, that if you have infection with SARS-CoV-2, you can have 50 to 65 cases per every 100,000 infections. Versus a vaccine, as of January early this year, there were only 12 reported cases of post-vaccine myocarditis in over 8.5 million vaccines given. So extremely rare with a vaccine. And what we do know about it is that it is age associated. So in that 12 to 17-year-old male group, it is higher. And so for some of those kids now, the CDC has recommended is giving between that first and second dose of the vaccine for the Pfizer, is giving, instead of doing it at 3 weeks, considering up to 8 weeks for that second dose to really reduce the risk of the myocarditis. Now, You have to take into consideration what is happening around your community. So if you're seeing a high rate of COVID, then you do run the risk of getting COVID infection if you wait that long to get that second dose. But if you have a low rate, then you might want to consider extending that second dose to a longer period so that you can reduce that risk of myocarditis.
Well, thank you for that data. That was really helpful. We have a question. In our local children's hospital, we are still doing pre-procedure PCR testing. Do you see this ending at some point? It's kind of an interesting question, given that we know that quite a few people who are considered hospitalized with COVID are actually COVID positive patients, meaning that they are not in the hospital due to COVID. They're there for another reason, another medical reason, and then they test them and they have COVID. So that being said, that's kind of when those infectious, you try to keep anyone else from getting infected with COVID while they're at the hospital. That's what I'm trying to say. Olga, do you see that ending anytime soon, doing that PCR testing?
You know, I think it's important to do, we've had this debate because, you know, a lot of our patients, when they go in for a procedure, that's one of the things that they really don't want to have to go through. They're already nervous about having to have whatever procedure, anesthesia, or you know, whatever that they're going to have to be going through. And then now to add a COVID PCR test, which is not pleasant to do. But the reason why we're still doing it is because you are putting these kids, if you're putting them under general anesthesia, that is not, you know, a completely, you know, non-risk situation. So you want to make sure that you're not adding to that risk. And if there are COVID infected, and a lot of these kids already have underlying medical conditions, which is why they're going to have procedures. So you want to make sure that we're not, that we have the child as healthiest as they can be before doing any type of procedure like that.
Thank you. I appreciate that. Also, if you guys have any questions for our experts, be sure to ask them in the Q&A down at the bottom of your screen. Let me look through and see if we have anything else coming in right now.
I mean, just to follow up on what Olga was just saying, I mean, you know, we don't routinely test a PCR for flu for hospital inpatients. And even though we now know from the work of Andrew Hayward in the United Kingdom and others that there is asymptomatic flu infection, which we didn't used to think was the case, but
there's asymptomatic flu infection. Is that what you just said?
It exists, yes. Huh. Yeah. People can be PCR positive for flu without symptoms. So, you know, maybe 20 years in the future we won't be doing PCR for COVID for people, but in the hospital because we don't do it for flu now, for example. But I just don't think we're there yet. I mean, if I were a hospital epidemiologist, I'm more of a community epidemiologist, but if I were a hospital epidemiologist, I would want, you know, the people on my wards to know which patients are positive for SARS-CoV-2. And I think at least for the next 12 to 24 months, it would be my guess, if not longer, just to be clear, that we would continue to do PCR tests for hospitals. It's kind of the bane of my existence when I look at these hospital data, because it's always like, well, how many of these are incidental and how many of these are people hospitalized for COVID? And I've been trying to get the county health departments to be more scrupulous about separating those tallies. But you know, everyone's kind of got their hands full. So it's a really excellent question, but I think for the time being, it's going to be around.
Yeah, you're right. They do not usually break those out separately. This is an interesting question. Once we get vaccines approved for the youngest cohort, do you anticipate private daycare facilities might require them? I guess meaning that the children might be required to be vaccinated. Again, like there's no vaccine requirement for COVID-19 for the children that are old enough right now, 5 and older. There is not one to attend schools. And there might be one going into the 2023 school year, but that's still really being debated at the statewide level. So from my perspective as a reporter, I haven't heard of any daycare facilities requiring it, or to be clear, requiring, they might be able to require it among their staff, but I haven't heard of any that actually do that. Do either one of you guys want to talk about that?
Well, I mean, I know when the state first talked about the K through 12 vaccine requirements for COVID for, as you said, the following school year, it was in the context of after they were fully FDA approved for the relevant age groups. You know, there's been a lot of water under the dam since then. I don't know what the current state of the proposals are from Sacramento, but it seems unlikely that like like a daycare for a 2 or 3 year old child is going to require you know, is going to mandate vaccination for those children anytime soon. Olga may have her thoughts on that as well. But
Finally was able to join on the internet. I apologize for that. In regards to requiring vaccines in daycare, I agree until it's approved, and I'm not really sure that they would have the legal authority. I don't know what the legalities of that would be to be requiring in the younger kids. So I think there's a lot to take into consideration, but I haven't heard, and that's an excellent question, because I hadn't actually even thought about it. But that is an excellent question, but haven't heard anything in regards to any proposals for that.
I'd like to talk a bit about kids who might be immunocompromised and can't get vaccinated. Is there, I mean, what do you recommend for kids who are in and obviously parents in that situation? I mean, can they have, I've never said it out loud. Is it Evusheld? Like, I don't know what the therapeutic is. I don't know if it's approved for younger children. Those are shots that aren't vaccines, but they are available for people who are immunocompromised, that can help keep them from getting, well, I shouldn't say it keeps them from getting COVID-19, but it can kind of prime their immune system a bit.
I haven't seen any of that information for the younger kids, so I really can't comment on that. But in regards to what can we do, is just as you had mentioned before, is the cocooning, making sure everybody around them is vaccinated, protecting them in that situation. But I haven't seen any evidence or any studies or anything in younger children.
Well, we've got about 10 minutes left. So if you guys have any questions for our experts, please post them in the Q&A function located at the bottom of your screen. We've spent a lot of time obviously talking about vaccines because there's a lot of questions, I think, related to vaccines. But I do want to open it up to either one of you. I mean, is there anything else that you want to add that we didn't cover related to kids and COVID? I mean, there's a huge mental health aspect to all of this, including for parents and caregivers. I get questions all the time about when they can get their kids vaccinated. And I think there's a lot of relief, I think, tied to that and having your children be vaccinated. And people think that might, I don't know, maybe they could go travel this summer or something. They feel more open to those options. But is there anything else on this topic that you guys would like to talk about?
I think one area that we didn't talk about was the return to play for athletes and how COVID has affected that, because that has been something different that we are practicing in pediatrics. And what that refers to is, as we had talked about, is the myocarditis, or the swelling of the heart, and the heart effects that the COVID infection, SARS-CoV-2 infection, can cause. So the American Academy of Pediatrics and the American College of Cardiology came up with recommendations that for kids who have had COVID, especially our athletes, these are kids 12 and above who play sports, who are more elite athletes, that we do need to screen them before returning them to normal play, because there is that risk of mild heart effects due to the infection. And so basically, if you have had a severe infection where you've been in an intensive care unit or have had multi-inflammatory syndrome, then those kids really need to rest for 3 to 6 months and then need cardiology clearance before going back to play. Or if they've had a moderate disease, meaning that they've had fever for more than 4 days or have had more than 1 week of symptoms, then those kids should have an EKG or an electrocardiogram prior to going back to their normal activities, just to make sure that they don't have any underlying heart disease. So that is something different when we do our sports physicals that we now have to take into consideration. And now, have you had a history of COVID infection is now part of our regular screening questions, even for well child physicals.
Yeah, that's really interesting. And can you explain to me then what the danger is if they do go back to playing, sports before their body is ready?
Well, if they have an underlying heart condition, so the myocarditis is the swelling of the heart muscle, so they can have any type. They can have any type of heart failure. Basically, they can go into an arrhythmia where their heart would start beating abnormally, and they can have. We've seen kids who have been out on sports field and they just drop there. Those are the things that we want to avoid, any further damage to their heart or them having an acute myocardial infarction out on the sports field or while they're doing any type of activity. So those are the things we want to avoid, or heart failure, where their heart can't pump as well. So those are the things we want to avoid.
Yeah. Wow. That's really interesting. Thank you for bringing that up. I had not heard of that at all. Andrew, is there anything that you wanted to bring up that we didn't cover?
I wanted to mention, now that kids can be vaccinated or very shortly under 5, the strategies for kids are going to look a lot like the strategies for everyone, which is not just vaccination, because it's clear, as I said, unfortunately, that just vaccination isn't working perfectly for adults. I think masking is going to be part of the strategy for all of us, but also, and I want to stress this, indoor air quality, particularly in schools in the context of children, but for office buildings and in grocery stores for the context of adults. When the big emerging disease of 19th century Europe was not COVID, but was cholera. And once they figured out that cholera was waterborne, they could have just told everyone, boil your water, or they could have fixed the drinking water supply so that it didn't mix with the sewage water supply. And they did the latter. They made a massive investment by 19th century standards to clean up people's drinking water, and that conquered cholera. And we're going to have to improve the quality of indoor air circulation, filtration, and in some cases, scrubbing with UV light to improve the quality of air that our kids are breathing in their school classrooms, and that we're breathing when we go to our places of employment. Because, I mentioned the mask because, I'm still masking myself when I go to the supermarket, but, I don't want to see kids wearing a mask every day from K through 12 any more than the parents who are watching this AMA want to send their kids to school K through 12 every day for 13 years wearing a mask. Kids are socialized to learn how to interact with one another and learn how to not hurt each other's feelings, in part by facial cues. Mm-hmm. And we don't want to, hide all our children behind masks, for every school year, their entire school career for that reason. And, it's an important part of their emotional development to read other human beings' facial cues. And so I don't want to see kids in masks, permanently, but COVID is here to stay. We're not going to eradicate COVID. And so we're really between a rock and a hard place. And that's why we're going to need to do what the 19th century Europeans did and invest, but not investing in clean drinking water, because with Flint, Michigan excluded, we already have that, but we're going to have to invest in cleaner indoor air for all of us. That's going to be, the sort of long-term good. I think it's going to come out of this, because it will also help against other things like influenza. But masking is going to have to be part of the solution in the near term. But believe me, to the parents watching, I don't want to see your kids behind masks for 13 years of schooling for the reasons I elaborated. So it's going to take a lot of investment of imagination and energy and science and money to solve the indoor air quality problem that is now presented itself as an unwelcome gift in 2020.
Yeah, that's a really good point. As someone who bought indoor air purifiers that have HEPA filters, it's something that I am acutely aware of. But, when you're talking about going into a building or your child going into a building, it's kind of difficult to ask those questions, especially if they say something like, oh yeah, there's a HEPA filter. You think, okay, that sounds good enough. I think it's also going to be a lot of people educating and getting educated on what it would take in order for it to be to actually produce cleaner indoor air. It's going to be difficult
Indeed.
and challenging.
Indeed.
Many stories to come.
Well,
oh, go ahead.
Well, as someone who teaches at the university level, I'm also interested in the CO2 levels in my classrooms, and so and we should all be. Indoor air quality is going to be the way out of this, I think, in addition to vaccination. But the point is, there's no single magic bullet. We've seen that with breakthrough infections in adults, and we were talking about whether our children will be revaccinated, will be boosted frequently. And so, this isn't the measles vaccine where you get 2 shots and you're protected for life. And at least it hasn't been so far, and so indoor air quality is the name of the game.
Well, thank you so much. I really appreciate it. I really enjoyed this chat, but I talk about COVID all the time. I want to say thank you to our wonderful experts, Dr. Andrew Neumer and Dr. Olga Gijon. Thank you for your time and expertise. And also thank you to our wonderful viewers for your thoughtful questions. If you missed part of the discussion or you want to just share it, you can go to laist.com/events. You will also find information there on our upcoming events. Again, I'm Jackie Fortiér, Senior Health Reporter at KPCC and LAist, so be sure to look for my stories or listen to your radio station. Thank you again and have a good night.
Thank you.